Good day everyone, this is Group 4 and we will be discussing about documentation. Before we proceed, let's define documentation under the context of cGMP. So documentation refers to the key to good manufacturing practice compliance and ensures traceability of all development, manufacturing, and testing activities. Now, we will discuss the following contents under documentation. First, principle. Second, the required GMP documentation. Third, the generation and control of documentation. Fourth, good documentation practices. Fifth, retention of documents. Sixth, the specifications. 7, manufacturing formula and processing instruction. And 8, procedure and records.
So, good day to each and every one of you. I would now be discussing to you the principle of documentation. So, basically, yung mga principle na ito siya, to sum it all up, it talks about how important documentation is in the quality assurance system as well as in maintaining good manufacturing practices. So, I hope that you will listen and that you will learn something from me.
So good day to each and every one of you. My name is Indian Hildy Tamayo and I will be discussing to you the principle of documenting. So first and foremost, good documentation constitutes an essential part of the quality assurance system and is key to operating in compliance with GMP requirements. Bakit po ganon? Kasi alam naman natin that through documentation, we are able to list down or report all the everything that happened during a test. So lahat ng changes and through those changes, makakompare natin yung result kung pumasok ba tayo sa standards. Kaya importante ang documentation sa any processing plants or manufacturing facilities para malista lahat. Incident 1, Incident 2, was na itong batch na ito, ganun siya ka-importante. Document may exist in a variety of forms including paper-based, electronic, or photographic media. So alam natin there is a variety of documents. Masyado na siyang basic. So, the main objective of the system of documentation utilized must be to establish, control, monitor, and record all activities which directly or indirectly impact on all aspects of the quality of medicinal products. Gaya na explain ko kanina, anything that is related to quality should be recorded, especially sa mga manufacturing kasi hindi tayo pwede po lumabas ng palpak na produkto. So, any issues, any subtle changes sa product, kailangan malista siya. So, ganun kaya importante ang documentation. At the same time, kung pumasa siya, check. Okay, pumasa itong batch na ito, okay, no issues. Okay. So, ganun lang din siya. The quality management system should include specific instructional detail to facilitate a common understanding of the requirement, in addition to providing for sufficient recording of the various processes and evaluation of any observation so that ongoing application of the requirements may be demonstrated. So, anong meaning ito? It means na ang documenting, hindi lang siya yung pag-record lang. Kasi di ba sa documents kasi napapaloob niya yung mga instructions kung ano ba talaga yung dapat gawin para magawa yung process na yan. So, isa yun sa to inform your workers or yung mga plant workers or yung manager mo, yung director ng manufacturing plant kung ano yung dapat na gagawin para at least kung any issues, madali nilang ma-resolve ba. Hindi sila makaka-hassle. So, nandyan na siya, tignan natin sa manual anong dapat gawin dito. So, kita lang sa manual itong gawin. So, yun na kagad na gagawin nila. And at the same time, through documentation, ma-implement natin yung policies na dapat implement. Tara, ma-comply natin kung ano yung requirements o yung standards para sa particular na product na yan. Para hindi mapasok. Kasi, isang damage lang sa isang batch, kung standard talaga yung manufacturing, once na-record yan na mali yan, hapon na yan sila lahat. So, ganun siya ka-importante yung documentation to avoid any mistakes na mangyari both sa product and para maiwasan na makonsume ito ng mga customers kasi masisira yung kumpanya. Kaya importante ang good documentation to monitor the quality of the product. Kaya na sinabi ko sa inyo kanina, yung mga documents natin, there are two primary types of documentation, which is yung instructions and yung records or report. So, sinabi ko rin sa inyo kanina, di ba? Yung mga instruction is part na rin siya ng documentation para at least maka-aware yung mga workers or yung sinong in charge dun sa manufacturing plant kung ano yung dapat gawin to counter any situation. At pinaka-importante, yung records and report. Para lahat ng mga incidents na nangyayari, anong kapalpakan, is malilista at i-avoid siya the next time na i-produce yung product na yan. And same time, para ma-check kung nagsunod ba talaga siya sa quality. Kaya importante yung records and reports para malaman mo rin kung ano yung pinuproduce mo, kung tama ba yun siya. Suitable control should be implemented to ensure the accuracy, integrity, availability, and legitimacy of documents. Instruction documents should be free from errors and available in writing. Yung kaya importante. Kasi pag may pumaltos dyan sa mga ginawa mong system, pag-document, hindi na mako-compare ng mga empleyado mo o yung workers mo sa plant or yung kasama mo ng mga researchers or yung supervisors, hindi na nila alam anong gagawin kasi hindi siya naka-state sa protocol. So dapat control should be implemented para alam nila kung ano ang gagawin nila at para ma-aware sila kung ano yung pasa at hindi pasa. Kasi pag hindi pasa, wala na, takbo na diretso para ma-ensure yung quality ng produkto. Sa instructions naman, kailangan clear and concise, di ba? No errors should be available sa writing. Kasi pag alam naman kung mali yung instruction mo, so mali din yung gagawin ng tao mo. So ibig sabihin nun, mali na lahat. Yung production process na yan, palpak na. Takbo na lahat ng produkto. So para maiwasan yun, it should be accurate and it should be correct. Walang space for any mistakes sa production facility. Because mistakes cause losses and a manufacturing plant or yung nag-produce ng mga gamot are a business. So if they lose money, pak na siya. Hindi na siya magiging profitable. So the term written means recorded or documented on media from which data may be rendered in a human readable form. So ibig sabihin written na maintindihan natin. Pag hindi siya maintindihan natin, ibig sabihin hindi na siya recorded or documented. Kasi dapat maintindihan siya. Kaya yun nga human readable form. So dapat maintindihan ng tao o magbabasa. So yun yung meaning ng the term written.
So I would now be discussing to you once more the required GMP documentation by type. So basically it is divided into sectors, instruction, and yung reports. Alam naman natin by the term instruction, mga processes, and reports yung data na nag-gather natin whilst doing the manufacturing process. So I hope that you'll learn something from me and you'll listen. Thank you.
So I would now be discussing to you the required GMP documentation by type. So let's first start with the site master file. Ano yung site master file? Site master file are document describing the GMP related activities of the manufacturer. So lahat-lahat ng paraan, techniques ng manufacturer o lahat ng ginagawa niya para nang i-maintain yung good manufacturing practices is napaloob sa site master file. Kumbaga, nandyan na lahat, kumbaga, pinapaloob nila lahat ng criteria, lahat ng paraan para i-evaluate kung kumasa sa quality ng product ng doon lang. Kasi alam na natin, if you're a good manufacturer, if you follow good manufacturing practices, your product is essentially quality siya and it should be trusted. So, let's start with the first type, instruction. So, pinaunahan ng instruction na type, specification. The specification describe in detail the requirements with which the product or material used or obtained during manufacturing have to conform. They serve as basis for quality evaluation. Similar sa pagpili natin ng cellphone. Di ba pag nabili tayo ng cellphone, dapat ito yung specs, dapat ganyan. Meron na tayong specs na nakapalagod sa ating makina. Para pag nagbili tayo, alam na natin ang mga hanapin natin. Similar to the manufacturing facility. They know kung ano yung produkto, ano yung raw mats na kailangan nilang gamitin para i-maintain yung quality ng products nila. So, yun yung specification. As para ma-evaluate kung saan tayo sa quality. The next is the manufacturing formulae, processing, packaging, and testing instruction. Provide detail all the starting materials, equipments, and computerized system to be used and specify all processing, packaging, sampling, and testing instruction. In-process controls and process analytical techniques to be employed should be specified where relevant together with acceptance criteria. So, simple ang explanation dito. Ito na yung instructions. Kumbaga, nandyan na lahat na kung anong dapat mong gawin para i-maintain yung quality ng produkto mo. From the formula, hanggang sa process, hanggang sa pag-package, hanggang sa pag-testing yan, nandyan na lahat. Kasi para malaman natin na yung produkto umasa sa quality. Di ba? Ngayon sa pinakadulo, in process control and analytical technologies. So, ibig sabihin nun, para ma-evaluate kung talagang pumasa na yung produkto na yan. Lahat ng techniques na kailangan gawin. So, yun, instructions nga. So, yun siya. So, another type ng sa instruction part is the procedures, also known as the Standard Operating Procedure or SOPs. They give direction for performing certain operation. So, as the name suggests, nandyan na yung instructions. Procedurals pala, kung ano yung dapat mong gawin sa mga certain incidents na mangyayari. The next is protocols. Protocols give instruction for performing and recording certain discrete operations. So, yung pinakaiba lang nila sa procedural is that ang procedure hindi ganun ka-discrete na operation. Kumbaga, normal lang siya. Yung protocol, for example, may mga issues, yung parang kailangan careful ka kasi pag nagkamali ka, it will cause losses to the company. So, discrete siya, kumbaga sensitive na mga parts ng kumpanya. So, yun siya. Yun yung instruction na binabay. As well as technical agreements or agreed contracts between givers and acceptors for outsourced activities. So, similar sa mga yung gumagawa yung mga phones good and manufacturing facilities, ito yung mga parang outsourcing kasi naghahanap sila ng way para magkuha nila yung paproduce yung isang bagay na mas mura or mas quality. So, nag-outsource sila sa ibang kumpanya o manufacturer na kayang gawin ito. Yung parang yung ginakuha mo yung services na isang kumpanya para i-produce yung isang bagay na gagamitin mo rin for your manufacturing industry or yung manufacturing company. Ganon din siya. So, ito yung technical agreements. Parang kontrata. It's contracts. So, I will now be discussing to you the second classification of GMP documentation by type, which is the records and report type. So, sa records, nakaloob nito ang lahat ng evidence na nag-follow ka or nag-comply ka sa instruction na pinupahid sa iyo in order to ensure quality of the product. So, it contains raw data. Lahat talagang raw, unedited, unfiltered na data yan nandyan. Para malaman kung tama ba talaga yung produkto na yan. Kung tama ba siya or pumasa siya sa quality. So, certificate of analysis. Certificate of analysis, nandyan na lahat ng testing na ginawa. So, summary na siya ng lahat ng test na ginawa sa produkto na yan to ensure quality. Nandyan na rin yung evaluation sa kanya kung talagang nagsunod ba siya sa stated specification ng manufacturing facility kung umasa talaga ito, produkto na ito. So sa reports, as the name suggests, reports, ibig sabihin, nilagay mo na dyan kung ano yung observation, ano yung investigation mo within the particular exercises whilst doing the manufacturing processes. Nandyan na yung results, conclusion, and recommendation mo kung kailangan pwedeng gawin para mas lalo pang i-improve or i-innovate yung production line. So, that's all for my report. Let me welcome you, Ms. Lizan Tumila, as the next reporter. Thank you.
Good day everyone, this is Lizan Tumila reporting, and today I'm gonna discuss to you about the generation and control of documentation. First, all types of documents should be defined and adhered to. This is required to all forms of document media types, thus complex systems must be comprehended, thoroughly documented, validated, and sufficient controls must be in place. Second, documents should be designed, prepared, reviewed, and distributed with care. They must adhere to the pertinent sections of the manufacturing and marketing authorization dossier, as well as the product specification files as appropriate. Third, documents containing instructions should be approved, signed, and dated by appropriate authorized persons. Documents should also be easily recognizable and have clear content, and it is important that the effective date is also provided. Fourth, documents containing instructions should be laid out in an orderly fashion and be easy to check. The language and style used in the documents should be easily understood and fit with their intended use. Fifth, documents within the quality management system should be regularly reviewed and kept up to date. And lastly, documents should not be handwritten, although there should be enough room provided for data entries in the documents where they are necessary. Next, we have the requirements for the good documentation practices. So here we have the requirements for the good documentation practices. First, handwritten entries should be made in clear, legible way. This way, it would be easier to read and understood. Second, records should be made or completed at the time each action is taken, in a manner that it makes it possible to track back all the major operations related to the product of pharmaceuticals. Lastly, any alteration made to the entry on a document should be signed and dated. The alteration should also permit the reading of the original information, and its reason should be recorded. And that's it for the requirements of the good documentation practices. The next slide will be discussed by Ms. Aini Faith Sahul.
Now we are here in retention of documents. So what is retention of documents? So retention of document, it is a practice where an organization must store and take care and protect the documents for a given period of time and as long as it needed. So 4.10, it should be clearly defined which record is related to each manufacturing activity and where this record is located. So, importante talaga na alam natin kung ano yung hinahawakan nating document at saan siya nabebelong at kung saan siya pwedeng itako. Secure control must be in place to ensure the integrity of the record throughout the retention period and validated where appropriate. And also, kailangan natin siyang itago sa isang lugar na kung saan hindi siya maapektuhan ng environmental issues like rain, fire, and moisture, and kung saan hindi siya ma-access ng ibang tao. And in 4.11, specific requirements apply to batch documentation which must be kept for 1 year after expiry of the batch to which it relates or at least 5 years after certification of the batch by the authorization person, whichever is the longer. So, yung mga batch documentation na kung saan na-expire na, yung mga documents or mga mga records nila, kailangan nila itago yun for just at least 1 year. And also, yung mga bago pa lang na-introduce into public, bago pa lang na-certified, yung mga batch na yun, kailangan ay tago nila yung documentations nila and mga records nila for at least 5 years. So, for investigational medicine product, the batch documentation must be kept for at least 5 years after the completion of or formal discontinuation of the last clinical trial in which batch was used. So, yung mga investigational medicinal products, ito yung silang mga NDA, like nag-a-apply for new drug. Kailangan yung mga documents nila, mga records nila, after nilang mag-discontinue sa clinical trial nila, kailangan nila itago yon, yung mga results na yon, yung mga documents na yon, at mga records na yon for at least 5 years. So, next slide, please. So, other requirements for retention of documentation may be described in legislation in relation to specific types of product and specify that long retention periods be applied to certain documents. So, nakadepende talaga, sa isang document, kung anong klaseng document siya, nakadepende sa kanya yung retention period niya. Bawat document kasi merong retention period, meron silang specific time kung hanggang kailan sila gagamitin at hanggang kailan sila pwedeng itago. Kaya may ibang documents talaga na panghabang buhay, may iba ding documents na for 5 years lang, tapos after 5 years, pwede na silang i-discard. And for other type of documentation, the retention period will depend on the business activity which documentation supports, and critical documentation including raw data which supports information in the marketing authorization should be retained whilst the authorization remains in force. So, meron talaga mga document na kung saan kailangan pa sila ng company or kung hanggang saan like sila yung dahilan ng function ng company, dapat itago talaga sila. For example, yung license ng company, hanggang hindi pa sila nagre-renew ng license, kailangan talaga nila itago yung license sila para merong validity at credibility yung isang kumpanya. And kagaya na din ng yung mga raw data, kailangan na hanggang sila ay naka-introduce in public, yung mga product na yun naka-introduce in public, yung mga clinical trials record nila, yung mga records nila kung saan nalalaman kung safe, effective, and may quality ba yung product nila, ay kailangan ding itago para if ever na
may mag-question sa kanila if ever na merong case na kung saan kinu-question yung validity ng product nila, meron silang maipapakitang documents na magpapatunay na dumaan sa ganito, ganyan yung mga product nila. So, it may be considered acceptable to retire certain documentation where the data has been by a full set of new data. So, example ito is driver's license. Di ba yung driver's license natin, valid lang siya for 5 years. And inside that 5 years, kailangan natin siyang dalhin at kailangan natin siyang itago in order to prove na marunong tayo mag-drive at nung nag-undergo tayo ng training and exams para makapagmaneho. And after the 5 years, kailangan na naman mag-renew ng bagong license. At yung old license mo, pwede mo na siyang itago or i-discard. And yung dadalhin mo naman is yung new license mo. So, justification for this should be documented and should take into account the requirements for retention of batch documentation. For example, in the case of process validation data, the accompanying raw data should be retained for a period at least as long as the records for all batches whose release has been supported on the basis of that validation exercise. So, yung mga documents na magja-justified at magsusupport ng basis and claims ng product mo, kailangan mo talaga siya itago hanggang naka-introduce siya in public. The quality management system should describe all documents required to ensure the product quality and patient safety. So, yung quality management system, kailangan talaga nila malaman kung anong document ang kailangan na ipasa ng mga ng isang company or ng isang product para malaman yung quality and safety ng isang product. And that would be all for my part. The next reporter will be Ms. Rosalia.
Hello everyone, I am Deborah Rosalia and I will be discussing the specification. Specifications for the starting and packaging materials and for the finished product should be documented. The following specifications for starting and primary or printed packaging materials should be included. First is the description of the materials, including the designated name and the internal code reference, the reference to pharmacopoeial monograph, the approved suppliers and the original producer of the materials, and the specimen of the printed materials. Second is the directions for sampling and testing. Third is the qualitative and quantitative requirements with acceptance limits. Fourth is the storage conditions and precautions. And lastly is the maximum period of storage before examination. For intermediate products, which are products that are partly processed and must undergo further processing steps before it becomes bulk product, such as uncoated tablets, solution prior to filling, and etc. Their specifications should be available for critical steps or if they are purchased or dispatched. It should be similar to the specifications for the starting materials or the finished product. Lastly is the specifications for finished products, which are quite similar to the starting materials. The specifications are as followed: the designated name and the code reference of the product, the description of the pharmaceutical form and package details, the direction for sampling and testing, the qualitative and quantitative requirements, the storage condition and any special handling precautions, and the shelf life of the product. Next, Ms. Zarza will be discussing the manufacturing formula and processing instruction.
And now I will be discussing the manufacturing formula and processing instructions. So in the pharmaceutical product development life cycle, there are many occasions when one is forced to relook or to check again and again the formula and processes. But most commonly, it is due to a squeeze on margins that awakens the management. So the manufacturing formula and processing is an exercise that an organization should undertake periodically to provide products and services that are of quality and to help enhance the gain the businesses could get from their product and services. Now to the next slide. The manufacturing formula should include the name of the product with a product reference code. So the product reference code describes a specific product, its specification. So when you hear product reference code, the keyword that you should remember is it is an identifier. So it identifies a specific product, its specification, like what I said earlier. The next is a description of the pharmaceutical form, kung semi-solid, solid, kung ano ba yun siya, tablet, or kung yung syrup, the strength of the product, and batch size. So the batch size is the number of units manufactured in a production run. The next is a list of all starting materials or raw materials to be used with the amount of each described. Mention should be made of any substance that may disappear in the course of processing. And we have here a statement of the expected final yield with the acceptable limits and of relevant intermediate yields where applicable. So, manufacturing active pharmaceutical ingredients often involve a series of processing stages, and at each processing stage, yield limits, yung mga ganito, are prescribed to ensure that the target yield has been achieved to give for a given batch so that the process engineers may proceed to the next batch of materials. So we have here the final yield with acceptable limits and relevant intermediate yields where applicable. Next, the processing instructions should include first, a statement of the processing location and the principal equipment to be used. So this equipment could be pieces of plant, machine, an instrument to do any specific activities. So it may be a mixer, a grinder, or granulator. Then we have here the methods or referencing to the methods to be used for preparing the critical equipment. For example, cleaning, assembling, calibrating, and sterilizing. We also have here checks that the equipment and workstation are clear of previous products, documents, or materials not required for the plant process, and that equipment is clean and suitable for use. Kasi, nasa FDA yan. FDA Code of Federal Regulations, Title 21. I will explain that later, mga sa later part of my part. Now, we have here detailed stepwise processing instructions. For example, checking on materials, pretreatments, sequence for adding materials, critical process parameters, which are the time or temperature. We also have here the instructions for any in-process controls with their limits. So process controls is an essential element for the quality management system, for it refers to the control of the activities employed in the handling of samples and examination processes in order to ensure that accurate and reliable testings are done. So we also have here, where necessary, the requirements for bulk storage of the products, including the container labeling and special storage conditions where applicable. And lastly is any special precautions to be observed. And here we have the packaging instructions. Approved packaging instructions for each product, pack size, and type should exist. This should include the following. Number 1, name of the product, including the batch number of bulk and finished product. Second is description of its pharmaceutical form, again, kung tablet, solid, kung syrup, liquid, and strength where applicable. Third, the pack size expressed in terms of the number, weight or volume of the product in the final container. Then we also have a complete list of all the packaging materials required, kung glass ba or plastic, including quantities, sizes, and types with the code or reference number relating to the specifications of each packaging material. Again, basta code or reference number, specifications, identifier. We also have here, where appropriate, an example of reproduction of the relevant printed packaging materials and specimens indicating where to apply batch number references and shelf life of the product. Then we also have here, checks the equipment and workstation are clear for previous products, documents, or materials not required for the plant packaging operations or line clearance, and that equipment is clean and suitable for use. So, line clearance is not only important for maintaining safety, quality, and efficiency, but it is a requirement of good manufacturing practices within the pharmaceutical industry. So, na-mention ko to earlier, yung FDA Code of Federal Regulations, Title 21. So, it states that meeting procedures shall be established and followed for cleaning and maintenance of equipment, including utensils, used in the manufacture, processing, packing, or holding of a drug product. So there are procedures included but are not necessarily limited to the following na given. So I will not be reading all of it, but you can search the FDA Code of Federal Regulations 21 for you to know the procedures included in that, since it is again a requirement of good manufacturing practices, lalo na sa ating industry, the pharmaceutical industry. So manufacturers that fail to perform and document line clearance procedures can be subject to regulatory action. Okay, so next, we have here special precautions to be observed, including a careful examination of the area and equipment in order to ascertain the line clearance before operations begin. We also have here a description of the packaging operation, including any significant subsidiary operations and equipment to be used. And lastly, we have details of in-process controls with instructions for sampling and acceptance limits. Again, I also talked about the process controls earlier, about its essentiality. Now at the batch processing record. So a batch processing record should be kept for each batch process and should contain the following information. We have here the name and batch number for the product, dates and times of commencement, kung kailan nag-start, of significant intermediate stages, and of completion of production. We also have here the identification or initials of the operators who performed each significant step of the process, and where appropriate, the name of any person who checked the operations. So, parang familiar siya yung sa record book na na-introduce ni Ma'am Ima yung first day talaga, di ba, yung tour. So, sabi niya, each equipment, merong record book talaga. So, here we have each batch process, meron silang batch processing record. Tapos, di ba, sa record book ay kailangan i-input yung name, date, yung equipment na ginamit. So, just like here, you should include the name and batch number of the product, the dates and times. Then you also have to include your name if you are the one to operate the equipment. But here lang sa thought na to, it is the batch processing record lang. And we have here the batch number and or analytical control number, as well as the quantities of each starting material actually weighed, including the batch number and amount of any recovered or reprocessed materials added. We also have here any relevant processing operation or event and major equipment used, a record of the in-process controls and the initials of the persons carrying them out, and the results obtained, the product yield obtained at different and pertinent stages of manufacture, notes of special problems including details, with signed authorization for any deviation from the manufacturing formula and processing instructions, and finally approval by the person responsible for the processing operations. Now on to the batch packaging record. So a batch packaging record should be kept for each batch or batch process and should contain the following information. Number 1, the name and batch number of the product. Number 2, the dates and times of the packaging operations. Number 3, identification or initials of the operator who performed each significant step of the process, and where appropriate, the name of any person who checked this operation. Again, parang siya yung record book na steps na nasabi ni Ma'am last time na na-explain ko din kanina. Then we also have here records of checks for identity and conformity with the packaging instructions, including the results of in-process controls. We also have here the details of the packaging operations carried out, including references to equipments and the packaging lines used. We also have here, whenever possible, samples of printed packaging materials used, including specimens of the batch coding, expiry dating, and any additional overprinting. And we also have here notes on any special problems or unusual events, including details, with signed authorization for any deviation from the packaging instructions. Then we have here the quantities and reference number or identification of all printed packaging materials and bulk products issued, used, destroyed, or returned to stock, and the quantities of obtained product in order to provide for an adequate reconciliation. Where there are robust electronic controls in place during packaging, there may be justification for not including this information. Then finally, we have here the approval by the person responsible for the packaging operations. And now we will move on to the next reporters, Christine and Mark.
Now, let us proceed to procedures and records. First, let's define the terms. So, procedure refers to the set of actions or the particular way of doing something, whereas records pertains to the documented set of actions or process. Let's start with the receipt. Receipt refers to the proof or acknowledgement that a transaction has been made or an action has been made. For receipts, there should be the presence of written procedures and records for the receipt of each delivery of each starting material. These materials includes the bulk or large quantities of materials, the intermediate or finished goods, primary, secondary, and printed packaging materials. Also, the records of the receipts should also include the following: the name of the material on the delivery note and the containers, the in-house name or the code of material if it is different from A, the date of receipt, the supplier's name, and the manufacturer's name. It should also include the manufacturer's batch or the reference number, the total quantity and number of containers received, the batch number assigned after the receipt, and any relevant comment. For 4.24, there should be written procedures for the internal labeling, or the label that is affixed to the immediate container of the drug product, the quarantine and storage of starting materials, the packaging materials, and other materials as appropriate. Now, let us proceed to sampling. or the ways or method we must do in order to make or gather something. For 4.25, there should be written procedures for sampling, which includes the methods and equipment to be used, the amounts to be taken, and any precautions to be observed to avoid any contamination of the material or any deterioration in its quality. Note that this is important because without this, we won't be able to trace or track what went wrong with the products. Now for testing. Of course, in every stage of manufacturing process, different materials, tests, and products that describe the methods and equipment to be used should have written records. And for other cases, in 4.27, it is stated that written release and rejection procedures should be available for materials and products, and in particular for the certification for sale of the finished product by the authorized persons. These records should be available and accessible to the authorized person. A system should be in place to indicate special observations and any changes to the critical data. And that's all for my part, and the next slides will be discussed by Mr. Saza.
Thank you, Ms. Belebeto. Now, moving on, records should be maintained for the distribution of each batch in order to facilitate recall of any batch if necessary. Now, we know that most of the commercial products that we have today are made in batches. And within these batches, each of these products most likely have the same quality and characteristics of one another. Therefore, if one of these products is found to have a defect, then the rest of the batch is known to be compromised. Hence, by recording and maintaining the information about these batches and where they go, we can facilitate an effective product recall. Next, there should be written policies, procedures, protocols, reports, and associated records of actions taken and conclusion reached. Within this category, we have first, validation and qualification of processes, equipments, and system. Second, we have personal matters such as signature list, GMP training, technical matters, and even complaints. Third is we have investigation on non-conformances and deviations, and lastly, summaries of records. It is important to have these documents since not only does it provide intellectual integrity of the company itself, but also for future endeavors. Let's take, for example, in company research. We can use the accumulated data that we have for years and create better and efficient processes, protocols, or find better equipment to provide a better and optimized products that we want to achieve. Next, there should be clear operating procedures when using major items in manufacturing and test equipment. The same thing can be said during laboratory activities, right? We use laboratory manuals as references to guide us into doing the task successfully and with less error. In the company, same thing can be done by having clear, detailed operating procedures. We can have less errors and guide the personnel using these equipments and procedures to do the task successfully. Moving on to the second to the last part, logbooks should be kept for major or critical analytical testing, production equipment, and in areas where products are being processed. As we discussed the importance of documentations earlier, these logbooks can be a great asset in documenting data, results, and associated events that transpired within these important procedures. Moving on to the last part, inventory of documentations within quality management system should be maintained. Like the laws that we have in our society, these documents should be maintained as to keep the information about our quality management system intact, and therefore solidifying the quality of our products consistently in the future too. That's it, everyone. Thank you for listening. We are Group 4, representing the company Nanocure. Safety we secure, quality we assure.